Hi, my name is Christina. I'm a BSN student. I am doing my final physical on my 20-year-old Caucasian female patient. I started off by gathering all of my equipment needed. I have provided privacy for the patient. I performed my hand hygiene. I observed the patient whenever she came into the exam room. I was looking at her mobility and gait. I looked for any deformities. There doesn't appear to be any deformities that I can see right now. Her general appearance, she is clean, she's not disheveled. Her clothing is appropriate for the weather. Her skin color that I can see right now appears to be consistent with ethnicity. I'm going to go ahead and then look at her hands. I'm going to feel around. Okay, and I'm going to check cap refill. Okay, cap refill was at 2. I was looking to see if there was any tenderness or deformities in the hands. There was not. I was also looking at her nails. They're clean. They're not too long. They're not too short, like she'd been biting her nails or anything like that. I've also observed her mood and affect. It appears to be appropriate to the situation. Her speech and her hearing are intact. She seems to be able to hear me just fine. She's got good nutritional status. She's not obese. She's not overly thin. Next, I'm going to go ahead and move on to the head part of the exam. I'm going to go ahead and palpate her skull and her scalp. Okay, and what I was doing here, I was checking for any lumps or bumps or lesions on the head, and there are none. Her cranium is normal, cephalic. Her hair is clean, dry, it's free of debris. She doesn't have to seem to have any insects infestation like head lice. Next, I'm going to go ahead and I'm going to check for facial symmetry. So I'm going to have you look at me. I'm looking for symmetry in the eyebrows, the eyes, the nose, the mouth. They are all symmetrical, as well as the ears. Again, her color is consistent with ethnicity. Next, I'm going to go ahead and palpate her temporal artery. So I'm going to go ahead and feel here in her temples. Okay, those are strong and equal bilaterally +2. I'm going to go ahead and now test the temporal maxillary joint. I'm sorry, temporal mandibular joint. So I'm going to place my hands here. I'm going to have you open and close your mouth twice. Okay. There didn't appear to be any cracking. The movement was smooth. Next, I'm going to go ahead and move on to the maxillary and frontal sinuses. So I'm just going to palpate here. Move down here. Okay, was there any tenderness there? Okay, so there's no tenderness or enlargement with the frontal sinuses. Next, what I'm going to go ahead and do is I'm going to go ahead and move to the eyes. I'm going to do the corneal light reflex, which is I'm going to go ahead and shine my light into your eyes. Okay, and what I was looking there for is the light shines in the same spot in both of the eyes, which it does. Next, I'm going to do the red reflex test. I would go ahead and take my ophthalmoscope and I would shine it into her eyes. And what I'm looking for is that red glow to fill the pupil area. Then I would go ahead and I would do my confrontation test, which is going to check her peripheral vision. So what I'm going to do is I'm going to have you tell me whether you can see my hands, okay?
Okay. Okay.
All right, so peripheral vision does seem to be intact. Next, I'm going to do the 6 cardinal positions of gaze. So I'm going to have you follow my pen light here. And basically what that does is it checks cranial nerves 3, 4, and 7, and they all seem to be intact. There was smooth movement, there was no nystagmus present. Next, what I'm going to go ahead and do is the cover test. So I'm going to take my card here, and I'm going to go ahead and have you stare at the pen light, and I'm going to cover each one of your eyes one at a time, okay? Okay, great. And basically what that was testing for is to make sure that her gaze is fixed whenever I move the cards to either eye, and it was. Next, I'm going to go ahead and just examine the external structures of the eye. So I'm looking at the eyeball, I am looking at the eyelashes, there's even hair distribution, curves outward. There doesn't appear to be any drooping of the eyelids. Eyebrows are symmetrical, the hair is evenly distributed on the eyebrows as well. Next, I'm going to go ahead and look at the conjunctiva. So I'm going to pull your bottom eyelid down. Okay, to the other side. Okay, conjunctiva is pink. The sclera is white. There's not any broken blood vessels or anything like that. Next, I'm going to check cornea, irises, and the pupil size. The irises are an evenly distributed blue. The pupils, I would measure the pupil size here. Generally, the size is between 2 and 6 millimeters. It's generally appropriate for pupil size. Now I'm going to go ahead and check perla. So I'm going to shine a light in your eyes. Okay. Okay, great. Now what I'm going to have you do is I'm going to have you stare at this pen light, and then I'm going to have you look at a spot on the wall directly in front of you. So look at the pen light, and then look at the wall, and then the pen light again. Okay, so pupils are equal, round, reactive to light, and accommodating. Next, I am going to do the, I would do the Snellen chart, which what I would have her do is, I would have her stand 20 feet away, and I would have the Snellen chart on the wall, and she would read the numbers to me from biggest to smallest, and that just checks visual acuity. The further down the list that she gets, the better her vision, indicates better her vision is. Next, I'm going to go ahead and move to the ears. I am going to inspect the external structures of the ears. Again, they're symmetrical. Color is consistent with ethnicity. There doesn't appear to be any bumps or lesions on the external part of the ear. And then I would go ahead and examine in her internal ear. I'm looking at the ear canal, and I'd be looking at the tympanic membrane with my otoscope. So I would pull the pen up and back to visualize the ear canal and the tympanic membrane. And I'll do that to the other side. Up and back on the penna. Okay. And with this, I would be looking for any excess drainage, which there's not. Ear canal is free of debris. The tympanic membrane should be a pearly white. Next, I would go ahead and I'm going to go ahead and do the whisper test. So I'm going to stand on one side of the patient, and she's going to repeat back the numbers to me.
3, 2, 1. 1, 2, 3.
Okay. And the patient is able to repeat those numbers back to me appropriately. Next, I'm going to go ahead and I'm going to move to the nose. I would inspect the outside of the nose. Again, it's symmetrical. I'm going to go ahead and look inside your nose. Lift up. Okay, the inside of the nose, the nares seem to be clean and free of debris. There's no excess drainage, there's no lesions. Skin is pink and slightly moist. Now I'm going to go ahead and occlude one side of your nostril and test the patency of each one of the nostrils. Both nostrils seem to be patent. While I was inspecting inside of her nose, I was also looking for any deviated septum, and there was not. Next, I'm going to go ahead and move to the mouth. Again, I'm looking at her lips. They are symmetrical. Go ahead and open your mouth for me. Lift your tongue up. Okay, go like this. Okay, and stick your tongue out for me. Okay, and then go ahead and say ah, ah. Okay. What I was looking for here is her buccal mucosa, which was pink, moist. There's no lesions on her gums, any hard or soft palate. Her teeth are intact, they're white, they're clean and free of debris. The gums are dark pink, they're not bloody or appear to be inflamed. The uvula is midline. Whenever she said ah, it did go up just slightly, which is a good thing. Her tonsils are intact, they're graded at a +2. I also checked her gag reflex, which indicates that her cranial nerve 9 and 10 are intact, and her cranial nerve 12 is also intact whenever she stuck her tongue out. Next, I'm going to go ahead and move on to the neck. Again, I am looking for symmetry of the neck. Her trachea does not appear to be deviated at all. I'm going to go ahead and palpate your neck, and I'm going to check for lymph node tenderness, so let me know if they're tender at all. Is there any tenderness there? No. Okay. There's no tenderness of the lymph nodes, and there doesn't, I cannot palpate any of the lymph nodes, so there's no enlargement there. I am also going to go ahead and look for any jugular distension, which I do not see. There's no pulsations visible in the neck. I am going to go ahead and palpate your carotid artery. Okay. Okay. Pulse is strong on her carotid artery. I am going to go ahead and then move on to palpating her trachea and her thyroid. So I'm going to have you turn here, and to palpate the thyroid gland, you need to stand behind the patient to get that good. So I'm going to palpate the trachea first, and this is more of a deep palpation, so it might be a little uncomfortable, but it shouldn't be painful for the patient. And then I'm palpating the thyroid glands. Go ahead and swallow for me. Okay, great. There's no enlargement of the thyroid gland. Trachea, again, is not deviated. Next, I am going to go ahead and test the range of motion in her neck. So I'll have you turn back this way. I will have you look to your right, to your left. Okay, and then I'm going to have you do this again, pushing against my hands. Right. Okay, and then left. Okay, great. I'm going to have you press up on with your shoulders. Okay. And then I'm going to have you move your head toward your right shoulder and move your head toward your left shoulder. And then have you chin to chest, and then put your head back. Okay. There doesn't appear to be any problems with the range of motion in her neck. She's got good muscle strength in her neck. So I'm going to go ahead and move to the chest. While I've been doing my exam, I've been looking for symmetrical chest expansion, which it has been. There doesn't seem to be any labored breathing or use of accessory muscles with her chest. Shoulders are also symmetrical. I'm going to go ahead and test chest expansion. So I'm going to slide behind here, and I'm going to put my hands around rib cage. Okay, I'm going to take a deep breath. What I was looking for here is to make sure that my hands were moving symmetrical once you took a deep breath in, and they did. Next, I'm going to go ahead and I'm going to auscultate the anterior lung fields. Nice deep breath. Okay. anterior lung fields are clear. There was no clear bilaterally. There was no wheezing or bronchi that I heard. Now I'm going to go ahead and have you turn just a little bit. Okay, that's good here. Okay, now I'm going to go ahead and move to the posterior side of the chest. What I'm going to start with first is to palpate for tactile firmitus. So I'm going to use my hands here and go ahead and say 99.
99. 99.
Okay. That tactile firmitus was present, which is what we're looking for. I'm going to go ahead and palpate the posterior side. Get back here. Move to the front just a little. Okay, was there any tenderness? Okay. So there's no tenderness or lumps that I can feel on the chest at all. Next, I'm going to go ahead and percuss over her posterior lung fields. I'm going to avoid the clavicle area. What I was looking for was resonance on that sound, and there was. Next, I'm going to go ahead and auscultate her posterior lung fields. Lungs are clear, even, unlabored, symmetrically. There's, again, no wheezing or bronchi that I heard in the posterior lung fields. Next, what I'm going to go ahead and do is the bronchoscopy test. And I am going to have the patient say 99 while I listen to her posterior lung field.
99. 99.
I could hear the patient was saying something, but I could not distinctly make out the word 99, which is what we're looking for. Next, I'm going to go ahead and move to the heart. I'm going to go ahead and auscultate first the 4 valves. I'm going to start off second intercostal space, right sternal border, and listen to the aortic valve. I'm going to move over left sternal space. And that's a pulmonic valve. I'm going to go to fourth intercostal space, left sternal border, and listen to the tricuspid. Okay, and next I'm going to go to the fifth intercostal space, midclavicular line, and listen to the mitral valve, and with women it's usually right underneath their breast tissue. Okay, and then I'm going to listen for S1 and S2. And next I'm going to go ahead and use my bell and do the same thing. Okay, all right. Now what I'm going to go ahead and do is I need to listen to her apical pulse. I'm going to listen to the rhythm of that. I'm going to go ahead and count it. So I'm going to go ahead and stand on this side of you and I'm going to listen to that. I'm going to count it for a full 60 seconds. Patient did have normal sinus rhythm. Apical pulse was 83. Next, what I'm going to do is I am going to go ahead and test her brachial and radial pulses. Here. Brachial and radial pulses are both strong and equal bilaterally, +2. Next, what I'm going to go ahead and do is I'm going to test her muscle strength and her range of motion in her shoulders, and her arms, and her wrists, and her hands. So what I'd like you to do is I'd like you to go ahead and go like this for me, and then with the other arm, and then go like this for me, and then the other arm, and then underneath. Now I'd like you to go ahead and put your arm all the way out on one side, and then on the other. Okay, and then can you go ahead and make a circle with your wrists? Okay, and then you can put your fingers out, make a fist, and then can you lean them this way, and then back in. Okay, and go ahead and squeeze my fingers. Okay, and then go ahead and push against my hands. Muscle strength seems to be good. Range of motion in her shoulders, her arms, and her hands seem to be fine. So I'm going to go ahead and I'm going to move to the abdomen part of the physical. Okay. So what I'm looking here is first I'm just inspecting the skin. Again, it is consistent with ethnicity. There doesn't appear to be any pulsations present in the abdomen. Contour is rounded, it's symmetrical. Umbilicus is midline and inverted. Next, I'm going to go ahead and I am going to auscultate for valve sounds, and I will also auscultate for any vascular sounds. Stand over here, and I'm going to start. Valve sounds in all 4 quadrants were normal active. There was not any bruits that I heard in femoral or aortic arteries. Next, I am going to go ahead and move on with the palpation. I'm going to start with light palpation, and then we move to deep palpation, or palpation. Okay, so there's no lumps or masses present on the light palpation. The skin is warm and dry and intact. Next, I'm going to go ahead and move on to the deep palpation. Okay, then I'm going to go ahead and try to find the liver borders here. So I'm going to go ahead and use the hooking technique. Lift up here. I'm going to go right under the rib cage. Okay. And I cannot feel any of the liver borders there, so I'm going to go ahead and try to feel this for the spleen. Go ahead and take a nice deep breath for me. I also could not feel for the spleen, which is a good thing. I'll go ahead and put your shirt down. Which is a good thing because that would mean splenic enlargement. Chloe has stood up for me. Go ahead and turn this way. All right. Next, what I'm going to do is I'm going to go ahead and move on to the lower extremities. I'm looking for symmetry, which they do appear to be symmetrical. There doesn't appear to be any elongation of one leg over the other or foot over the other foot. I am looking for the skin. It does also appear to be symmetrical, consistent with ethnicity, and there doesn't appear to be any lesions or anything like that. I'm going to go closer. Okay. Skin is dry. There doesn't appear to be any tenderness or lumps there. There's no edema present. The hair, she shaves her legs, so there's no hair there, but there is slight hair on the top of her feet, which is evenly distributed. She doesn't have any varicose veins or anything like that that I can see. Next, I'm going to go ahead and palpate her popliteal pulse. It's right here. Okay. I'm going to check dorsal tail pulses. Okay. So her popliteal pulse, her dorsal pedal pulse, and her posterior tibial pulses are both strong equal bilaterally at +2. Now I'm going to go ahead and while she's sitting here, I'm going to go ahead and test a few other things. I'm going to start with having you lay back down this way. Okay, go ahead and lay all the way back. Now what I'm going to do is I'm going to have you close your eyes. I'm going to have you put your right heel below your left knee. And I want you, with your eyes closed, to slide that down to the bottom of your foot. Okay, great. And then do the same thing with the other leg. Okay, so her heel to knee down to shin test was intact, and that just tests her neurologic status. Next, what I'm going to have you do is I'm going to have you go ahead and sit up. I'm going to go ahead and test range of motion. I'm going to go ahead and test your Babinski reflex also. So I'm going to have you lift your foot up, and this patient is particularly ticklish with this test. Babinski was negative, which was what we're looking for. With positive Babinski, the toes would fan out, and that's not what we would want. Indicates some type of neurologic damage. So I'm going to go ahead and I am going to move this out here, and I'm going to test range of motion with her lower extremities. Okay, so what I would like you to do is I would like you to go ahead and bend forward and try to touch your toes. Okay, and then go like this, and then the other way, and then try to lean over this way, and then the other way. All right, and put your knee over this way, the other way. And now I'm going to go ahead and have you do a deep squat. Okay, and go ahead and move your foot in a circle. And the other one. Okay, and you can wiggle your toes just fine. Okay, great. So I was basically checking for range of motion in the spine, the hips, the knees, the ankles. She's got good muscle strength on all of her legs and her feet. Doesn't appear to be any problems with any of those structures there. Next, what I'm going to have what I'm going to test for is I'm going to test have her do the Romberg test. So I'm going to have you stand in a corner here, and I want your feet together and your hands at your side, and I want you to just close your eyes, and I'm going to time this for 20 seconds. You can go ahead and open your eyes now. What I was checking there is neurologic function. I want to make sure that she was able to not sway excessively or open her eyes or lose her balance with doing that. Now I'm going to go ahead and I am going to have her sit back down here. And I'm going to go ahead and sit here for me. I'm going to do the rapid movement test. So I'm going to have you put your hands on face down on your knees, and I'm going to have you slap your hands. Okay, and then go ahead and turn your hands over and do the same thing. Okay, so I want to check function there, and she is able to perform the rapid movement test without any problems. Next, I am going to do deep tenon reflexes. I would first start with the brachioradialis reflex here in your wrist. Okay, and then I'm going to test the knee jerk reflex. Okay. And then I'm going to test the Achilles reflex. And relax your foot. Relax it. The reflexes should be at +2, not overly or underly exerted. Next, I am going to check her neurologic status again, and I'm going to take my object that has, it's just a Q-tip, it's got a sharp side and a dull side. I'm going to check that on her face, her arms, her hands, her legs, and her feet. She's going to be able to determine, she should be able to determine dull or sharp side. Okay, so close your eyes for me. Sharp, okay. Dull, okay. Go to your arms. Dull, sharp, and and then your hands. Sharp, dull. Okay, and then your legs. Sharp, dull. And your feet. Sharp, dull. Okay, so she was able to determine correctly the sharp and dull side of the Q-tip. All right, next I'm going to have the patient, I would give her privacy to get dressed. Do you have any other questions for me right now? Okay. At this time, I would go ahead and discuss any plans that we may have, discuss any follow-up appointments and make those that there may be, answer any questions she might have. And this concludes the final physical assessment. Thank you.